Hi, my name is Gina Scott. I am the Program Director of Medical Assisting at Lone Star College-CyFair. Welcome to our information session for the year 2021 through 2022. Usually we do have these on campus, but because of the COVID restrictions, we are doing these online. Usually also these are about 2-hour presentations, so I've condensed it all in about 20 minutes. So please view the slides carefully. If you have any questions, please call Diana Penna at 281-290-3275. Lone Star College is proudly accredited by CAHEB, which is the Commission of Accreditation of Allied Health Education Programs, upon the recommendation of the Medical Assistant Review Board. Is medical assisting right for me? Are you looking for a meaningful job? Do you like helping others? Do you have an interest in health and medicine? Are you a people person? Are you good at multitasking, switching tasks throughout the day? Do you like a variety of your job? Would you like to enter a career in an expanded field? If you answered yes to 5 or more questions, congratulations, medical assisting could be the right career choice for you. Also, a great help would be to get onto the American Association of Medical Assisting website, which is the AAMA. This is our national organization. I've been a member since 1984, and it has a lot of helpful information about the career itself, the pay, and so forth. So I very much encourage you to log on to that website for more information about our career. Join the career that cares. Medical assisting is one of the nation's fastest growing careers through 2026, according to the United States Bureau of Labor Statistics. This can be attributed to a predicted surge in the number of physician offices and outpatient care facilities, technological advancements, and the growing number of elderly Americans who need medical treatment are also factors for the increased demand for medical assistance. So what do certified medical assistants actually do? We work under the direct supervision of a physician. We have a great amount of variety in their jobs, cross-trained to perform many clinical, which is our back office areas, and our administrative duties. Some of the administrative duties, which is the front office, include computer applications, including the electronic health record, answering phones, greeting patients, updating and filing patient medical records, coding and filling out insurance forms, scheduling appointments, arranging for hospital admissions and laboratory services, handling correspondence, billing, and bookkeeping. Some of the back office areas or clinical duties are taking medical histories, explaining treatment procedures to patients, preparing patients for examination, assisting the physician during the examination, collecting and preparing laboratory specimens, performing basic laboratory tests, preparing and administering medications as directed by a physician, drawing blood, taking electrocardiograms, removing sutures, and changing dressings. And you can see from the next 2 slides, these are our students from this year doing the various back office areas, including vital signs, sterilization and disinfection, as well as doing injections and performing venipunctures. Medical assistant course content. The program itself is a 1 year. It starts in August and finishes in August, and it concludes with a clinical externship practicum. First semester is medical terminology, administrative procedures, and clinical procedures, as well as business English and business math. Those classes are both taught online. In the spring, we have laboratory procedures, anatomy and physiology for medical assistants, medical insurance, interpersonal communications, and pharmacology. This summer, we have medical law and ethics, certified medical assistant review, electrocardiography, CPR, and first aid, which is summer 1. And then in summer 2, you're actually in a doctor's office doing your practicum externship for 6 weeks for a total of 240 hours. The estimated cost, now this is a high average, which is around $6,000. Your financial aid usually does pay for that. Of course, you have to do all of the paperwork through FAFSA. So if you have not done that, I suggest getting on that and doing all the requirements for that. The first semester is your most expensive, of course, because you're buying all your equipment. The tuition itself is $1,440. Now, this would be different if you're out of district. I suggest looking at our catalog for the cost for that out of district tuition. Textbooks are around $500. Uniforms, stethoscope, shoes, that's going to vary depending on how many uniforms you're going to buy. Our bookstore does our uniforms for us, which are unique. They are embroidered and navy, and they're only specially made for our program. Laptop computer, if you have a very good laptop computer, of course you won't need to buy another one. Your hepatitis B and physical examination will be required if you get accepted into our program. Of course, if you've got an insurance copayment and it's only $20, this cost will not apply to you, but I do put the average cost if you do not. Background check is required for our program, and it is around $45. The drug testing usually is not done until the end of our courses. Some offices do require you have drug testing before you start, and that's an expense that you would have to pay for, and it's usually around $40. Second semester is tuition. Again, it's 16 hours and your textbooks. Then third semester, which will be in the summer, only 7 hours with the tuition of $630. CPR and first aid courses. This year I've got those to be only $40, so it's not the $65. The medical assistant regalia is your cap and gown for graduation at the Berry Center. The pin, we do have a pinning ceremony. The first slide showed a picture of our pin. One of my first year students designed that pin, and it's only designed for our program. It is sterling silver, and we do order those for the pinning ceremony. The CMA examination is required to take. It is our national examination that we do take, and it is required. Most offices make you take that within 2 to 4 months after graduation, and the cost for that is $125. This is our admission criteria. Just know that there's no prerequisites to get into my program. However, there are criteria, which is on a score sheet, that I accept 20 students. The score sheet is included in your application process for you to understand how I do the selection process. The majority of your points is based on PSB test, which I'll go over. The remainder, it will include any type of prior college courses that you may have taken, which is like English 1301 or Math 1314, which is college algebra. I can only see these results through your advisor's checklist that you send to our advisors. I am not able to look at your transcripts through my account, so this checklist has to be scanned and sent to our advisors. They fill it out and they send it back to you, and then when I do the score sheet, I look at those and give you extra points. Also, if you've had any volunteer service that is documented by a letterhead, I also take that into consideration. So the score sheet is just for your information only, and it lets you know how I do the selection process. So first of all, of course, the requirement is to attend an information session, which you are doing now by listening to me. Please email or call Diana Penna. Her email address is diana.penna@lonestar.edu, and her phone number is 281-290-3275. She will send you the application process with everything that I'm talking about. You need to register and take the PSB Health Occupations Aptitude Test. Now, there's really no studying for this, and even if you Google it, it may come up with the sonography questions, which is physics, and it sometimes scares students away. So please do not Google it, as the medical assistant questions may not pop up on that. There are study guides that you can buy. However, it really is not necessary to do. It is just where you stand right now in the following subjects, which is academic aptitude, spelling, reading comprehension, natural sciences, vocational adjustment index. So It is a 2 to 3 hour test, so please be prepared to take that. It is proctored by Pearson, and it does cost $85. Please follow the link that I've shown on the screen for testing instructions. The advisor's checklist is in your packet. You will need to scan it, put your information on top, scan it, and send it to either Mrs. Trotter or Ms. Pingrance at the emails listed on the screen. They will complete that by looking at your transcript, and they will send it back to you. That needs to be included in your packet so I can see if you have any credit that I can apply for previous courses, and makes also sure that you have no holds or anything on there that would cause you not to be into my program. The final acceptance, of course, is on a background check. This does not need to be completed, of course, until you've been accepted into the program. However, if something does come back on your background check, a felony or misdemeanor, you will not be able to get into the program. You will not be able to take the CMA test because of the felony. So the entire completed packet must be sent all together as one PDF file to diana.penna@lonestar.edu, and it includes, again, the pre-application checklist, the advisor checklist completed by the advisor, the application for admission, and the results of the PSB test. The guidelines, I do spend at least 24 to 26 hours a week with my students. We are in class anywhere from 8 to 1:30 depending on the semester, usually Monday through Thursday. On Fridays, we are here in the spring for lab classes, and we also use Fridays if we need to do makeup days because of inclement weather or other problems that may arise. Please make sure you have adequate transportation and daycare to be on time. Your attendance is part of your grade. When you do start your externship, you will be there from 8 to 5, Monday through Friday, just like a regular 40-hour work week. We do not teach medical assisting courses online other than your business English and business math classes, and we do not offer any evening classes at this time. Some of our standards and guidelines also include any confidentiality and HIPAA regulations that you may have to deal with, especially on your clinical rotations at your extern sites. They are really impeccable about keeping patients' confidentiality, and just know it is a requirement for the program. Conduct reprimands, I usually don't have any problems at our college. However, these would include any alcohol, drugs, or doing or class or clinical work, any unprofessional or dishonorable conduct, which may deceive, defraud, or injure any patients, public school personnel, other students, and faculty, aiding any students in deceiving or attempting to deceive the faculty in obtaining or exam or other required schoolwork, damaging, destroying, or stealing school or clinic property or equipment, being disruptive, habitually late or absent from class or clinical, using profane language or gestures, physically or verbally assaulting, disrespectful, or being confrontational to other students, teachers, faculty, and clinical supervisors. Our guidelines also include this slide, which our accreditation and our system requires to let students know of the eligibility requirements to take the CMA exam, stating again that you cannot have a felony or pleaded guilty to a felony. You will not be able to take the CMA examination. The clinical dress, again, our bookstore sells our specific uniforms. They are navy with our medical assistant embroidered on it. It also has our patch that we have on the left side of our sleeve. They are only to be worn with white t-shirts underneath. They must be clean and neat. White nursing shoes, white leather is the best, as the white tennis shoes do get really dirty. Hair secured should be off the collar in the lab. Fingernails should be neat and clean. You cannot have artificial nails. No excessive jewelry, wedding bands, and stud earrings only. No rings will be worn in other conspicuous areas of the body, including the tongue, nose, eyebrow gauges, or rods in the ears are not allowed. Cosmetics and perfume should be used conservatively. Hair color should be of a natural color, pink, purple, blue, red. Other uh, uh, really unnatural colors are not acceptable. Tattoos must be covered at all times. Expectations, just to let you know, we are in healthcare, and we will be dealing with certain things that may be challenging, including giving injections. We do practice on the wonderful mannequins that we have in the lab. However, after a lot of practice, we do practice on each other. There's not another medical assistant program that I've ever known that does not practice on other students. That's the only way to learn. We also do those with venipunctures. We have great mannequins. We practice on that. Then we practice on each other. Just to let you know, we will be, we are in healthcare, so we will be exposed to bloodborne pathogens, including possible for HIV or hepatitis B viruses or any other viruses. Examinations, we do not do any gynecological examinations in our lab. However, you will be assisting with these in a doctor's office, including any type of pap smears and breast exams. American Association of Medical Assistants have their code of ethics, which we do follow. And this states the members of the AAMA dedicated to the conscientious pursuit of their profession and thus desiring to merit the high regard of the entire medical profession and the respect of the general public, which they do serve, do pledge themselves to strive always to render service with full respect for dignity of humanity, respect confidential information obtained through employment unless legally authorized to acquire by responsible performance of duty to divulge such information. This would include any type of child abuse, spousal abuse, any type of diseases, communicable diseases that are required by law to report, uphold the honor and high principles of the profession, accept its disciplines, seek to continually improve the knowledge and skills of medical assistants to benefit patients and personal colleagues. Once you are certified, you are required to have 60 continuing education units every 5 years to keep up with your certification, to keep you current. Also, participate in any additional service activities aimed toward improving the health and well-being of the community. Our last slide is our creed. Our medical assistants, their last statement to me at their pinning ceremony, I do tell them to raise their right hand and repeat after me. I believe in the principles and purposes of the profession of medical assisting. I endeavor to be more effective. I aspire to render greater service. I protect the confidence entrusted to me. I am dedicated to the care and well-being of all people. I'm loyal to my employer. I am true to the ethics of my profession. I am strengthened by compassion, courage, and faith. And I say congratulations. You are now medical assistants. So this is the conclusion of the information session. I do want to let you all know that our college and the system as a whole has done a tremendous job in getting our students back into school with the COVID restrictions. They have gone and exceeded what is unbelievably a task to keep personal protective equipment, 6-foot distancing, our classrooms, our labs, everywhere sanitized for the restrictions of this. My students can tell you as well as myself that it is a very safe environment. We've been back since June with little or no complications at all. I'm very proud of that. And so with this going forward, maybe even into 2021, 2022, with the COVID restrictions, I just want to let future students know and to be at ease that we do everything possible to make sure your safety is of utmost importance, and that this should help you also as a student, but just know as you are helping other people upon your externship, if they are sick with any type of diseases, including COVID or any health problems. That's what we do to make a difference in the healthcare. If you do have any further questions, you can please call Diana Penna. She's most available to you as I'm in class most of the time. However, I will get back to you as soon as I can. My personal phone number in my office is 281-290-5274. That is my office phone. Or you may email me at gina.scott@lonestar.edu. This information is also on our website. I hope that you would be interested into our program. We have a lot of fun as well as learning, and looking forward to the next year. Thanks and have a great day.